In April 2012, 6-year-old Emma Whitehead was fighting a losing battle with leukemia. After years of unsuccessful treatments, doctors informed her parents that she may not make it through the night. However, Dr. Stephen Grupp, pediatric oncologist at Children's Hospital of Philadelphia, decided to take a gamble and fight fire with fire, using HIV to treat Emma's leukemia. The December 18, 2012 New York Times reports, doctors removed millions of Emma's disease-fighting white blood cells and used genetically altered HIV as an immunological directed missile. Essentially, the HIV was used like a drone against her cancer. 3 weeks after the treatment, Emma was in complete remission. And the Huffington Post of December 18, 2012 reports that 8 months after the treatment, Emma was cancer-free. No leukemic cells in her blood or bone marrow, and no more bulging lymph nodes on her CT scans. Doctors estimate that the treatment had killed off approximately 2 pounds of cancer cells. This new HIV-incorporated therapy treats severe cases of leukemia in both children and adults. The January 14, 2013 LA Times reports that this treatment can be accessible to the public in as little as 5 years. Because this therapy has the potential to reshape the way that we address HIV and offers a potential cure for what was once known as the cureless cancer, it is imperative that we evaluate this study by first taking a close look at the traditional approach towards leukemia, then looking at the reconstruction of cells, before finally discussing the implications of this groundbreaking yet shocking approach. First, Emma, like most individuals diagnosed with leukemia, undergo a series of treatments without a guarantee of them working. To understand the true innovation behind this therapy, we must first take a close look at the traditional treatments before turning to this new HIV-incorporated therapy. The Leukemia Research Foundation reports that the first efforts to try and cure leukemia started as far back as 1845, when German pathologist Rudolf Virchow started experimenting with white blood cells and realized that individuals with leukemia had elevated white blood cell counts. Unfortunately, Virchow was unable to come up with any solution to leukemia. Then in 1947, Sidney Farber started experimenting with folic acids, but much like Virchow, was unable to come up with a viable treatment option. By 1962, Emil Frederick and Emil Frey III started to incorporate chemotherapy, which became the standard that we use today. Mayo Clinic reports that chemotherapy, radiation therapy, and bone marrow transplants are the standard for treating leukemia, but they are highly intrusive procedures and come at a price tag that is close to $150,000. Yet, in early 2010, Dr. Carl June and his team at the University of Pennsylvania's Perelman School of Medicine decided that they wanted to accomplish what researchers have tried for decades: train a person's immune system to kill cancer. As reported by the New England Journal of Medicine in November of 2012, June and his team led a series of experimental studies in which they had to find a property that could detect cancer, attack it, multiply, and survive inside of the patient. Because HIV is naturally wired to attack, infect, and take over any cell given the opportunity, June decided to take his chances. The January 14, 2013 LA Times reports that June and his team isolated the HIV virus and stripped it of all of its devastating properties that cause AIDS. Because this HIV virus is completely disabled, the patient does not suffer from the HIV infection. Out of 12 case studies, all but 2 patients went into complete remission. As a new treatment is on the horizon, it is imperative that we look at the science behind the reconstruction of these cells. In order to stabilize Emma's immune system and make sure that she is cancer-free, researchers had to stabilize her white blood cell count. To do so, the Globe and Mail reports on December 11, 2012, that researchers isolated the HIV virus and had to get the HIV virus to kill the B cells which are responsible for her leukemia. To do so, they created a protein called a chimeric antigen receptor on top of the HIV virus. This artificial protein matches another protein only found on the B cells, which are responsible for her cancer, and thus draws the HIV cells to the B cells like magnets. It's kind of like the Showtime television series Dexter. Dexter, or HIV in this case, were once harmful and killed innocents. In the case of Dexter, it was animals, and in the case of HIV, it was healthy blood cells. But then Dexter was completely rewired and wanted to establish peace in society. Because Dexter is in the police force, he is well aware of anyone who commits crimes and gets away with them, so he goes after them and kills them. In the case of HIV is able to recognize any property within the human body that kills healthy cells, and thus goes after them. As a result, these new genetically modified HIV cells kill the B cells that are responsible for the leukemia. These cells are then injected back into the bloodstream, and the patient becomes a bioreactor. Sky News of November 18, 2012 goes on to state that these engineered cells help boost the immune shield and help spot cancer that was previously able to sneak under the radar. The aforementioned Australian Sky News goes on to state that the result was complete, and the boosted immune shield continues to remain in the patient and protect them from the reoccurrence of cancer. Third, Dr. June's approach raises a multitude of questions, giving rise to both medical and social implications that must be explored in detail. On the medical side, as this treatment has had an 84% success rate, it has become a vital stepping stone to eradicating all cancer. The New England Journal of Medicine of November 2012 reports that gene therapy will become a common and crucial part of healthcare. As this treatment has been successful in multiple cases of leukemia, researchers are starting to apply it to other forms of cancer, including lymphoma, breast cancer, and colon cancer. Moreover, this treatment has become more cost-efficient, allowing access to patients who previously would not be able to afford the treatment. According to the Daily Mail of December 11, 2012, this treatment costs approximately $20,000, 7 times less than the current standard. As such, individuals are getting more access to this treatment who previously wouldn't have been able to afford the current price tag. Because of its efficiency, both financially and medically, Dr. Stephen Grupp exclaimed in an interview this past summer that this is the answer for cancer. But on the social side, the positive use of HIV cells to cure multiple diseases may bring funding back into HIV awareness. According to the Wall Street Journal of December 3, 2012, with the introduction of drugs such as AZT, which prolong the onset of AIDS, funding for HIV research has dramatically decreased. The Journal of Nursing and Health Science of June 2009 reports that apathy is one of the main causes for the decrease in funding. After 25 years of research and activism for HIV/AIDS, every time that we hear about it, we tend to tune out. The journal goes on to state that apathy directly impacts fundraising, with fundraising dropping 34% from 2000 to 2009. Yet the CDC reports in 2013 that an individual in the United States is newly infected with the virus every 9.5 minutes, or approximately 6 people by the time that this round is over, resulting in 55,000 new infections in the U.S. annually. 25% of them being in individuals under the age of 24. With a positive use for these HIV cells, hopefully more funds will be funneled into HIV research, resulting in a cure for this silent killer. Emma Whitehead was lucky to have doctors who fought fire with fire, using HIV to treat her leukemia. Today, we examine this new HIV-incorporated therapy, its applications and implications. And while this research is relatively new, it may be the answer that we have been looking for all along.